So we'd like to discuss with Dr. Shah how he is thinking about improving the healthcare situation in India. So Dr. Shah, tell me about your journey from India to here.
Well, I came to the United States in 1978 after my MD in Bombay. And I came to UCLA where I was a research fellow in cardiology. And after having spent 5 years in cardiology as well as in nuclear cardiology and interventional cardiology, I came into practice in Orange County. So I've been in practice for the last 25 years and have been here since that time.
So Dr. Shah, as an Indian doctor, did you face any kind of racial difficulty in understanding the patients, or let's say in going up the chain? I mean, what's your racial experience in this country?
I think this is a very open country. I did not experience any kind of a prejudice. As a matter of fact, because of our Indian accent, sometimes the American patients are unable to understand us, and therefore we have to speak slowly and sometimes repeat our answers. But they were very kind just to ask again. And I have been very fortunate that I've got this place in this country. One thing is there, that if you are capable, you will rise no matter what. But we as Indians will face a glass ceiling at the top. And that glass ceiling has to be cracked one way or the other. But if you're determined, I think you can crack it.
Dr. Shah, I also know that for quite some time now, you wanted to help India and you wanted to set up hospitals in India, but you mentioned that you faced some political difficulties and other kind of difficulties. So can you tell me about your interest in setting up in hospitals in India, and what kind of problem did you face in the past?
No, I've had no difficulties as yet. The difficulties in India is that most of the hospitals are in large cities, large metropolitan cities, and the facilities in the mid-level cities or the smaller cities in the rural areas is lacking. So I don't think there's any problem as yet. I have not really faced any great difficulties in trying to do that, but I hear the bureaucracy in India and the red tape in India, and obviously in the big cities now the real estate prices have gone up so much that it's almost impossible to get the infrastructure for healthcare started in major metropolitan cities. At the same time, there are so many hospitals in places like Bombay and New Delhi that there is a greater need for hospitals in other cities and rural areas.
So Dr. Shah, did you ever approach to any Indian leader for setting up with any hospital or any of the plan for setting up some healthcare facility in India?
Well, 15 years ago, I had gone to Bombay and to the state of Gujarat to open a heart hospital, but I did not get a very positive reception at that time. And of course, at that time there were many labor problems, and I was discouraged from having an investment in India. But as the years have gone by and as the Indian economy has opened up, I find that more and more NRIs are going to India to serve their country as well as for business opportunities for themselves. So I think a positive attitude as well as a positive atmosphere is being created, and I think everybody, including the Indian government as well as the people of India as well as the NRIs, should exploit the opportunities for the benefit of all.
Dr. Shah, the major, I would say quite a large number of Indian population living in rural areas have no access to any healthcare, forget about quality healthcare. I mean, did you ever think that how Indian government can do something to pull that together, something for the common people?
Well, this is a very complex subject, but every nation has to go through an evolutionary process. The evolutionary process is you want to cut it off because April is there?
Yeah. Okay, let's stop. I mean, it will be recorded. I'll cut it out later. And now I think you can continue.
Yeah. Start again. Ask me again.
Yeah. Well, no, you can continue. I'll edit.
Okay.
So question.
Every nation has an evolutionary process in its growth and its economy. 30 years ago, there was rationing in food supplies. Milk was not available. Telephone lines were not available. Cars were not available. And as a result of which, our government as well as the people were more focused on the bare essentials of life rather than thinking about complexities of...
So you want to mean healthcare is not bare essential?
No, it is essential, but the simple parts of healthcare are already available in almost all these cities as well as in the villages. But as soon as you start getting into some complexities of surgery, like cardiac surgery or major orthopedic surgery, then of course the problems start because of the costs involved. So I think now that the Indian economy has gone to an extent where many states have become so prosperous that we have to start thinking of the next phase of our development. And the next phase of development will be partially, to a great extent, the healthcare process will have to be resolved.
So, Dr. Shah, how this emerging new technology can help to meet the new healthcare need of the people, I would say the poorer people as well as the rich people together?
Well, if you see the Western countries, in Europe as well as in the United States as well as Canada, they all have universal healthcare. Many of them have universal healthcare. In the United States, we don't have it as yet, but I think we are proceeding towards that particular goal. When there is universal healthcare, the people are not worried about their health, and through a private-public partnership, I mean that's what I would encourage. A private-public partnership. It's important to provide healthcare to all the people of the...
Well, Dr. Shah, I have a little bit of difference of opinion, especially coming from the people in Canada and United States about this universal healthcare, there is public healthcare system. I mean, they complain that they don't get the right doctor, they have to wait longer, it's not easily accessible. So they say, okay, fine, even if it's the government, the bigger problem is that accessibility to a doctor, especially in Britain and Canada, they always complain about. I mean, I'm sure you must have heard the same thing. So how do you justify the universal healthcare system? Because the people who are accessing it right now, they are not happy about the accessibility of the doctors.
Well, you got to understand the comparable situations between the nations. It's better to have a shortage of doctors, but at least get universal health care, than for a large portion of the population not to get any health care at all.
So how much of percentage of United States people are actually right now deprived of health care, any kind of health care?
Well, there are 45 million out of 320 million. So 1/8 of the population, I think, does not have healthcare insurance. But that does not mean that they cannot avail themselves of healthcare. They can go to the emergency rooms and they can pay for the healthcare through the pockets, especially simple healthcare like going to doctor visits, etc. But of course, it's a problem.
Now, what's your standing on the Medicare? I mean, like the baby boomer generation is coming, and there will be a big boom on the Medicare market, especially if you have to provide support to the older people. Do you think that US is prepared for that kind of infrastructure and that many number of doctors and nurses in the coming days?
Well, Medicare has been a boom to the people of the United States. Anybody who is over the age of 65 and anybody who is disabled gets Medicare, which is a federally mandated healthcare coverage for seniors. And under that plan, the patients can go to any doctor in the United States and get healthcare for themselves, either as an outpatient or even inside the hospital. And the best part is that as the years have gone by, the Medicare system has matured. So Medicare allows a certain amount of fees to be paid, and they won't pay anything beyond that. And therefore, it has set a standard for the fees to be paid by all the physicians. And now the insurance companies also, in a way, are following the same standard and going towards the same reimbursement.
Are you happy with the US health insurance companies, the very interaction between the doctors, hospital and the medical insurance?
No, I am not happy at all, because the healthcare industry and the insurance industry is mainly involved in making money, and they do have a great amount of bureaucracy.
So you want to mean like whether it's a lawyer or doctors who will take over to the industry? Is that kind of fight you are suggesting?
No, there's nothing with lawyers. I think it's mainly this is a maturity process of the whole marketplace. As the years go by and as the premiums increase, there is going to be a shout and cry, a hue and a cry from the people of the United States. And I think more and more people are now being convinced that some fixing of the healthcare system, one way or the other, has to be created. And obviously, many proposals are coming forward, but this country's method and the process is such that things are very hotly debated for months and years sometimes, but finally they come to a conclusion, which is always better than the previous system.
So, are you supportive that the malpractice insurance should be limited, or the amount of malpractice lawsuits should be limited?
Well, malpractices are lawsuits are important because it does raise the quality
but
of
do you demand any kind of cap or limit on that in terms of amount?
Oh yes, I think so, because sometimes they just go beyond the reason, and sometimes millions of dollars are paid for very minor or at least moderate sized of problems, and that raises the cost of the healthcare tremendously for the whole nation. So I think it's important to limit in an appropriate fashion, and many states have done that already.
Okay, so there's the other thing. So do you think this Medicare system should be also